Hey everyone, Dr. Pam Maragliano-Muniz, Chief Editor from Dental Economics Magazine, and I have the unique opportunity to spend a little time with Dinesh from Kuraray and Dr. Richard Young. Thank you both for joining me today. There are some new innovations coming from Kuraray. Dinesh, would you share what those are about?
Yeah, absolutely. So this year we are launching two new products at CDA. A new bonding agent, Clearfield Universal Bond Quick 2. We are replacing our old bonding agent with the new technology, Clearfield Universal Bond Quick 2. And also we have a new composite, which is a flowable composite. Maybe Dr. Yang can talk a little bit more about it, but it's a very special flowable composite. It's not your regular liner. You can use it as a restorative material.
So not your grandpa's old flowable composite, and out with the old, in with the new from a bonding agent perspective. Would you share the names of those?
Yes. So bonding agent is Clearfield Universal Bond Quick 2, and flowable is Majesty, Clearfield Majesty Universal.
Amazing. So now I'm going to put you on the spot because you've had the opportunity to play with these products and use them on your patients.
Correct.
Tell me the story. What's it about?
It's interesting. The flowable itself, I do a lot of injection molding with using, obviously, like a BioClear matrix. And we heat a lot of composite, but I've always wanted a flowable that had hydraulics to it, that had a little bit of firm, you just felt the hydraulics when you're injecting it. And I also wanted to have something that I could not heat if I didn't want to, but I could still get that flow as long as we, do things correct. So the experience with it, then I've used it. It's really amazing for that. It says everything they said. I ice creamed it on a case just to see how high of an ice cream cone I could make, and it stayed right where I put it. So that was really neat. So that coupled with the bond, it's pretty amazing. And I have to say, when it's polished, and I guess the question I'd ask Dinesh is, what I felt like it could handle guidance for like cuspid guidance, is in injecting, posteriors for raising vertical. It just seemed like it had the compressive strength. What are your thoughts on that? To be used even not just in the anterior, but in the posterior.
Yeah, absolutely. So we recommend it, officially we recommend it all cavity classes, class 1, 2, 3, 4, 5. So it's indicated for anteriors and posteriors. Why we recommend it, there's a big chemistry behind it. It's not that you make it flowable or you make it little easy to apply, reducing your fillers. We use a special filler coating technology, special type of a silane that you coat your fillers in the composite that allows you to have a less amount of monomers, high amount of fillers. That's what you get in our flowable. So you have a high amount of fillers, less amount of monomers. That makes it very stronger. It's 78% filled. That's why it has better physical properties. That's why we officially recommend it is in all cavity classes. So obviously you can use it in anteriors, you can use it posteriors, no problem. It's officially indicated.
So a flowable composite that can be used for definitive restorations of all class types, including guidance, including the compressive strength for a posterior tooth. What are your favorite cases to use this on?
So I do a lot of extreme stuff with composite, as I think our little presentation showed. So I was always impressed when I saw one of the dentists from Japan at a KOL meeting showing 10 and 12-year post-ops and full tooth buildups with flowable, and I think it was Majesty Flow. So I played with that, and so this seems even better. But the other area for this one is I do a lot with black triangles and injecting molding of composite. So with this, I feel like I can go with one composite. I don't need to chase it with a filled composite. And I actually tested it. I heated it, and it really handled nicely being heated. It didn't just come flying out and gushing out. So for doctors, the beauty of it in black triangle areas and small class 5s and things, they're not fighting shade issues. It's really pulling color nice in the cases I tried it on. So to me, it's like almost the ultimate combination with UBQ2 being with its low film thickness and 3-second contact bond combined with that flowable. It's almost a no-brainer. It's almost, frankly, too easy because we're not going to be messing with shade choices. So I think it's pretty interesting.
I love simplicity and injectable composites, using a single shade, making these things easier. having predictable outcomes and really beautiful outcomes. I saw your photos and they are very impressive. Now, you mentioned UBQ2. Would you share a little bit about the specialness of your bonding agent?
Yeah, I think Dr. Young already presented how important bonding agent need to be thin in aesthetic cases. You don't need a thicker bonding agent. But the chemical challenge, when you make it thin, its bond layer is going to be weak, not strong. So Kuraray R&D chemists work hard how to make adhesive thinner but stronger. So we introducing a new monomer. We started with MDP, then we introduced amides. Now we are coming with a new one called UTM, urethane tetramethacrylate. It's a methacrylate monomer, but makes adhesive very stronger. So we could make it thin, as he says, which is needed for extreme clinical cases. But you can, even in the regular clinical cases, sometimes most dentists prefer thin bonding agent. So it's thin but strong. So we are introducing a new monomer.
And a short time, right, to apply. You don't have to scrub it in for 20 seconds.
Yes, exactly. So most adhesives in the market, you have to scrub it 20 seconds. 20 seconds, how long it is. It's not that 20 seconds sounds shorter, but when patient is open mouth and you try to apply all over the cavity, 20 seconds is very long. Sometimes we feel like it's you need a lot of patience, and in the application time, if you have to do 20 seconds. This is because of the special amide monomer. There is no waiting time. You just rub it, and you can start air blow and start straight away.
So I'm going to date myself for a second. Have you seen those crazy glue commercials where there's the guy with the construction hat and he like hangs from the steel beam and he just has like crazy glue and he can hold his body weight? Well, I saw some of your cases with UBQ2 and you are bonding fragments of teeth that the traditional dentist would deem unrestorable, and you have extremely long outcomes. Would you share a little bit about that? You guys, it's super cool. Stay with me here.
Well, the long ones can't be UVQ2 because it just came out, but the bond tech, I'm a truster of bonds, especially with a company that I know, and so I'm really big on fragment placements, and the thinner the bond, a lot of times with the fragments, the better it is, and that's where I've been really impressed with this, is that you don't have a lot of film thickness there, but you have high bond strength. And I want to touch on the scrubbing thing too, because that's one of the biggest concerns in bonding. I've always been really particular, so I always ran an egg timer for 20 seconds, so I knew I was or you could always go more, but the idea was not to go less. Well, now we're not worried so much about dentists not handling it right. So, that thinness capability with this new technology, it changes the game. And it's hard to believe that we're in a one bottle bond that I'm willing to, hang my hat on from the ceiling. But I think it's getting there, and we'll find out as we test it more and more and push it.
Well, we talked about pushing the limits, but for traditional dentistry, this is a reliable, easy, efficient product that I think is worth checking out. Where can we learn more?
So all the information available at kuraraydental.com. That's our website. And if you come to the website, you will not miss it. It's kuraraydental.com.
Wonderful. Well,
Can I mention something in closing?
always, yes.
So the one thing I did fail to say is when you're doing, especially with the black triangles, with these different types of matrices, it's very hard for dentists to scrub in those areas for 20 seconds, to be honest with you. And that's where this bond jumps out off the page, is that it's thin, it doesn't pool, so when you air it and cure it, you don't have a pooling concern, but yet you can get it in and not worry about the time of scrubbing. So that's, for me, in my black triangle work, it's absolutely not even a question. So I just wanted to add that because I hadn't really covered as much.
That's really important, especially for those of us that try to be minimally invasive dentists. The black triangles that you were showing, I mean, obviously a diastema is a diastema, but those little black triangles, we don't want to prep the tooth, but we need space for the material. So if you have a material that requires a little bit less space, then that allows us to achieve the goals that we're trying to achieve. So I thank you both for your time. I know there's a party and like a line of people that want to talk to you both. So thank you so much for joining me. And everybody check out Kuraray's new products.